Hello, this is Dr. Maya Bachour over at Loudoun Smile Center, and I'm here today to answer some of the most common questions that we get about dental crowns. This is a hot topic. I want to try to answer question as of when do you need a crown, and how can the crown protect your smile? The crown is like a cover. Think about it like a helmet that comes on top of the tooth to protect the tooth if the tooth is broken or it's damaged or it's extremely decayed. The crown functions like a cover that has the same shape and the same color as your natural teeth. Most of the time you can't tell there is a crown there unless you take an x-ray, but looking in your mouth you won't be able to tell which one is the crown. And the reason we put a crown on the tooth is to save the tooth so we can keep it in your mouth for as long as possible. Not every damaged tooth or decayed tooth need a crown. Sometimes we can do fillings, we can do BioClear, we can do veneers, inlays, onlays. There are so many options. So it all depends on the type of damage, the amount of decay in the tooth, the amount of healthy tooth structure left, and the quality of the tooth structure that's left, and how much pressure does that tooth take in your mouth. So there are many factors that we look at before we decide if crown is the correct treatment for this tooth or not. There are different types of dental crowns. At Loudoun Smile Center, we're metal free. So all the crowns that we make are porcelain, ceramic crowns that are very aesthetic and very durable. We use something called zirconia as well, and that's a white material and it's very, very strong. We use it on the back teeth. When we're looking at material for dental crowns, we get the best of, we're looking at strength and beauty and longevity. And this is how we decide what material to use. There are different materials that can be used for dental crowns. The most common materials that are used are ceramic, porcelain like Emax, and zirconia crowns. Usually we use the zirconia crowns when there is a lot of pressure, like the back teeth, because this is a very, very strong material. And we usually use the different type of ceramic on the front teeth because we don't chew with them. And this is a very bright material that reflects really nice in the smile line. Most of the time, dental crowns are necessary after root canal treatments. Once we treat a tooth for root canal, we remove a lot of the internal structure of the tooth. We also remove the inside of the tooth, the nerve, the blood vessels, so the tooth become brittle and more susceptible to fracture. With the posterior teeth, with the back teeth that take a lot of pressure and we need them to chew, crowns are necessary for the biggest majority of the time. With the front teeth, we decide case by case whether crowns are necessary at this point or not. It could be necessary from a cosmetic standpoint to cover the color, or because the tooth had multiple fillings and decay that's before the root canal. So it's case by case. The dental crown procedure goes as follows. So we numb the tooth so you're comfortable throughout the procedure. We remove the damaged part of the tooth and the decayed part of the tooth. We rebuild the tooth with a very aesthetic white material to health. And then we remove some tooth structure, just enough to fit the ceramic on top of the tooth and restore your tooth to function. Most patients find the procedure way easier than they think it is. And the crowns look very natural, they're comfortable to chew with, they're strong, and they're long lasting. Usually it takes about an hour for a crown procedure to get the work done. Here at Loudoun Smile Center, we offer same-day crowns. So we have very advanced technology and milling machine that can produce ceramic crown the same day. If we're using this technique, it takes about 2 hours to produce the crown, and we're ready to deliver the crown the same day, and no temporary crown is needed. In other cases, when the temporary crown is needed, is when the crown has to be the scan, the digital scan. After your tooth has been cleaned and prepped, we take a digital scan. The STL file from the digital scan got sent to the lab. The lab will fabricate crown within a couple of weeks, and you would wear a temporary crown during these 2 weeks. Your visit to replace the temporary crown with a permanent crown is about 30 minutes. Usually, dental crown replacement does not hurt. You're numb throughout the procedure, so you should not be feeling anything. Most patients are surprised of how smooth and easy the procedure is. Dental crowns are permanent procedure. In order to place the crown on the tooth, we do remove part of the tooth structure, just enough to put the cap on it. So it's a permanent procedure, and it's meant to preserve your tooth and give you a strong teeth to chew with, or to restore your smile. Sometimes children can need crown. We do crowns on baby teeth, and the reason for that, if the kid has a very extensive decay that had reached the nerve inside the baby tooth, the crown will be necessary to treat the tooth and get the kid out of pain. But also we use the crowns on baby teeth as a space maintainer. We have to keep the space for the permanent tooth when the tooth come out. So there's space for the permanent tooth to come in the mouth. Crowns do look and feel like normal teeth. So we match the size of the tooth, the shape of the tooth, and the color of the tooth. You can chew normally and comfortably with a crown. Most of the time, you don't even remember if you have a crown in your mouth. They just function and feel the same way. The only way we find out that you have a crown is by taking an x-ray. The crown themselves do not get cavities. However, the bottom of the crown, the area where the crown meet with the tooth, if we don't take care of it properly, it can get decayed. Taking care of the dental crowns is the most important thing you can do after having a crown placed. So the crown itself does not get cavity, but the area underneath the crown where the crown meet with the tooth can get decayed. The best way to take care of it is brush your teeth, floss, use a water pick. If you grind your teeth, you definitely need a night guard or a retainer, and definitely keep your dental visits and dental cleanings. And crowns can last anywhere between 5 years and 20 plus years. It all depends on how well we take care of the crown, and also if the bite is balanced. Bite is a big part of the crown longevity. Most dental insurances cover dental crowns partially. Depends on the plan. There are different percentages the way they cover it, and they cover it for different reasons and in different ways. But here at Loudoun Smile Center, we do courtesy check. We'll get you all the insurance benefit that your own plan offer, and we will let you know what would be your out-of-pocket responsibility before we start the procedure. If you know that you need a crown and you would like to schedule an appointment, you can always call us at 703-297-4407, or you can schedule your appointment online at www.loudonsmilecenter.com. I hope I was able to answer most of your questions regarding dental crowns and who needs them and how to take care of them. But if you still have any questions, or you would like to know if a crown is necessary for you, you can always call us here at Loudoun Smile Center, 703-297-4407, and schedule a no-charge consult to find out if crown is the right treatment for you.